I've done a little bit of a trapezius roll with my fingers and thumbs. We did this on Thursday, didn't we? And then we've just started to work my way down through to the shoulder. So for the neckline, you want to create stretch from the sternocleidomastoid, which comes just behind the mastoid process, and the scalenes, which comes from transverse process 2, 3, 4, down through to the scalenes posterior. I think it's the second rib. The first rib is a little bit higher. So second rib, third rib, and second rib. So you've got posterior, middle, and anterior through here. Those were the muscles that we introduced last time. So they're coming from transverse process down, underneath the clavicle, and then attaching on the ribs through here. I got you guys to put in the interscalenes triangle. So just in here, there is not much muscle. There's the platysmus, which is a big old piece of muscle which fans out, but there's not much resistance to that. And you can just push through there, and then you're pushing down on the brachial plexus and the nerve roots, and that just hurts in there. So there's not really much benefit of doing that. So I've given you guys, we did the palpation. So for Maddie and Phoebe who weren't here, you might want to I'll show you how to palpate that in scalenes triangle. So really your work is coming from the mastoid process down to the acromion clavicular, the AC joint. Lighten up as you come over the AC joint and then work your way down the deltoids. And that just depresses the shoulder. We're trying to bring these shoulders down. These muscles will elevate the shoulder girdle. They will limit lateral flexion and limit rotation. So if anyone is a little bit stuck in those moves, you could get them to look behind them like they're driving a car. A lot of people go, I can't look behind because my neck muscles are so tight. The thoracic so tight. So this is just a nice little warm-up. Flat cam. I'm just working my way down through the neck. And I do have my other hand just supporting Phoebe's head here. Just absentmindedly put it on top of your head there. Hope that's okay. And then we want to try now create a little bit more stretch running down through these muscles. So rotating the head over towards the whiteboard will start to stretch out these muscles. And you could, again, the reason I got my hand here is we could just bring in a little bit of lateral flexion in there. The fact that Phoebe has got her arm bent means that there's still a little bit of slack in those muscles, but that's okay because we could start doing our therapy with a little bit of slack, and then straightening the arms will then add a little bit more resistance to your pressure. So I've got a thumb and forefinger, and I'm coming just up to the mastoid process, and I just start to glide my way down. Now from the mastoid process here, you could either go forwards to sternocleidomastoid, there, or directly on sternocleidomastoid, of which it's flicking around quite a lot, so I reckon that might be quite good. Or coming back and then doing the line of scalenes, either middle, down there, or posterior, down through here. And again, there's a little bit of flicking going on in and around there. So you've got 3 routes that you're following. This would also give you trapezius in this position. And it's like that grid work again. Go from the back, work your way through to the front. On some people, you can see where that tension line is. And for you guys, in terms of your practice, it's palpating. It's looking at where you feel like there is high tone in the neck. You can see it when they're standing. Are you okay with that? That pressure? Is that right? Mm-hmm. You can see it when they're standing.
The other side.
Oh, I should have done the other side. It's only because you're on show to most of the group on this side. And so you'll be able to feel where there is that tightness. And then so it's not a lot of technique, but it's such a sensitive area. I'm flicking over something here, which I think would be quite good to treat in there. So this might need a little bit of stretch on. So now if you just reach down towards your ankle, give that a little bit of a stretch out. Now that muscle, you can see it popping. That's the area that I was at. You can see it coming out. Now we've got a little bit more stretch on it.
Are you just holding it? Are you actually moving your finger?
I'm doing some little sympathy and frictions. Does that change the sort of pressure pain in there? Is it, as you know, is it even a painful spot for you?
Yeah, it's like, I mean, I can feel the tension.
A little bit of friction, coming back down and up, back down and up, and work your way down. So it's all about being slow, progressive. Feel like there's another little nice building there.
Yep.
Into that one. My thumb's doing all the work, but I want to give it some support with my top hand. A little bit of work on there. Flush through, come back, and then let's start moving down towards the very sort of origin. So that feels quite tight. follow it through, coming just in towards the shoulder joint, and there's your scalenes there. And again, it feels like there might be some tightness in there, but how does it feel for you?
Yeah, it does feel tight.
Cool. So we've got a good spot. So we've gone underneath the clavicle, and we're just trying to get down towards its attachment site. We could go finger and finger either side of the clavicle, and that can apply a little bit more pressure to it. Like this finger here is right on it. Is that good?
Mm-hmm.
You could encourage your clients at this point to do nice deep breaths. So breath in, breath out. That raises the rib cage, and it applies more pressure to the scalenes, so it makes it a little bit more tense. Good, nice deep breaths, and then you can encourage that breath work all the way through. Once I've gone down the posterior side, I mean, there's a lot of tension in that midline of the neck. I would go to the middle scalenes here. Again, you can feel it underneath my thumb. Scalenes there, scalenes middle. Nice deep breath. These can cause headaches, like tension headaches. So many problems, these muscles, these neck muscles. So it's really important that you guys get used to working these muscles. And then I feel like there's some tension here. So when I'm moving more forwards, I use my middle finger and apply pressure back down towards the table and into the transverse